All right, I'm going to take you through a simple range of motion exercise that I use on a regular basis when I notice that my neck is not moving the way that it should. There's two movements. There's rotation, and then there's lateral bend or side bending of the neck. And I know right now that my range of motion isn't quite right, so this is perfectly timed. I'll start with rotation, and whenever I do to one side, I do the other. And what I'll do is I'll just sort of on an active level, I'll turn my head on my own to see how far I can turn. And I'll do this in both directions. Right now I'm turning more easily towards the left than I am towards the right. I'm going to do a similar movement on both sides. So what I'm going to do is I'm going to turn my head, and then I'm going to use my hand, and I'm going to encourage a greater range of motion. I'm actually going to turn my head, I won't say forcefully, but I'll press into it to increase the range of motion. Now, a very important tip here is that most people will tend to use their chin. They'll push on their jaw or their chin to turn their head, and I'm going to advise against that. I know in my experience that occasionally will create some pain in my TMJ, my temporomandibular joint. So what I'm going to encourage you to do is use the bone that's just underneath your eye. And it's pretty stable, and you're not going to hurt yourself with this. So what I do is I turn, I'll use my hand, and I'll apply a pressure and I don't go crazy with this. I just apply a little bit of extra pressure to increase that range of motion that I couldn't otherwise get. So I'm going to add some pressure, and then I'm going to hold that for a 3 to 5 second count. And then what I'll do is I'll actively, with my neck muscles, press against my hand, okay, to try and push my hand away. But of course, I don't let it. I hold that position. I slowly release the muscles in my neck, and now when I press with my hands some more, I can get an even greater range of motion. And whatever, like I said at the beginning, whatever I do on one side, I do on the other. So I'll turn, 5 second count, and then I'll actively, for about the same amount of time, a good 5 to 10 seconds, try to press into my hand against this. I slowly release these muscles, and then I can gently press even further and get an even greater range of motion. So that's a great exercise. The next one is to do a side bend or lateral bend of the neck, and it's a similar principle. Lateral bending is not something that we need a lot of. We don't actually have much function or much use for doing lateral bend, but we do need some. And so what I will do is I'll show you how I do this. First, when your neck is not functioning correctly, there's a tendency, and you can watch yourself in the mirror and see what it is that you do. The normal coupled motion for a neck, as it bends to the side, is actually to turn. The normal motion is that your head should actually add a little bit of rotation inside the turn. When your neck is not functioning correctly, and you can ask your chiropractor to see if you're one of these people, and if you're not sure, but you can probably tell just in the mirror by looking, is that with a lateral bend, we'll have a tendency to turn to the outside. And that's a sign that your neck is not functioning correctly. So here I go. I'll do it from the front, and then I'm going to do it from the back so you can see what it looks like. So I'll gently, I'm only using about the weight of my arm here. I'll gently let my head bend to the side, and then I'll just rest the weight of my arm into this side bend. And right now I notice automatically that my nose started to turn outwards. That's because my neck's not functioning very well. I need to go see my chiropractor. And so I'll gently correct that so it turns slightly towards the inside. And again, I'm just using basically the weight of my arm to do this. And I'll hold that for a good 5 to 10 seconds. For this particular exercise, I will rarely use this PNF technique, this technique where I'll actively try to pull my head away from my hand. I'll do that with rotation, but I don't do it with side bend. So again, whatever I do on the one side, I'm going to do on the other. So I will go ahead and let my head fall to its natural range, and then use the weight of my arm, no more than that, and just sort of pull, let my head turn, and again making sure my nose is turned slightly inwards into the bend. And if I want to add a little bit more pressure without really doing this PNF stretch, what I'll do is I'll use my other hand. So I'm going to bend my head this way. I use this hand right here, and I latch onto the bottom of my neck, and I'll show you on the opposite side in just a moment. And it will gently pull towards the left, while my top hand pulls towards the right. So I get a two-way motion here to just slightly increase the amount of range of motion there. So I'll hang on at the bottom of my neck, hold on to the top of my neck, two different directions, and let the weight of both my arms be sufficient, with my nose turned slightly inward. And I'll hold that for 5 to 10 seconds. I'll switch it over to the opposite side. Again, just the weight of my arms, making sure my nose turns slightly inwards. And hold that for 5 to 10 seconds. And I can already feel this improved range of motion. I'm going to feel better, and the tension in my whole body has just gone down a couple of points. I'll show you the opposite side now. So everyone has noticed that they've got one bone at the base of their neck right there that's a bit bigger than the others. That's what I'm hanging on to. And if you notice, my left hand is pulling my head towards the left. My right hand is pulling towards the right. It's an opposite direction. So if you notice, I'm grabbing onto the opposite side of that bone to pull it towards the right. You'll be able to experiment and get a feel for what I'm talking about here. And like I said, everything that I do on one side of my spine, I always do to the opposite side. So now my left hand is pulling on the base of my neck, my right hand is pulling on my head. But again, in opposite directions. All right, thanks for watching. If you liked the video, I'd like you to do two things. Well, actually three things. The first thing is social sharing. Go ahead and click on one of the buttons below here to your right, either on Facebook or on Twitter, and share the information. If you thought it was good, odds are some of your friends will too, and they could benefit from the information. Secondly, I'd like you to enter your information in the box on the right and sign up for more tips like this. And third, I'd like you to do it. There's no point in watching this if you don't actually try it. My name is Dr. Paul Groulx, and I'll see you in the next video.